Touched on this important topic last week, and now during Men's Mental Health Awareness Month, which is June. Well, we're continuing the conversation today about a struggle many men face actually behind closed doors. Millions of men experience stress, anxiety, depression, and other mental health challenges as well. Yet, they don't say a word, you don't hear anything from them, part of this due to the stigma or even social pressures. Now, joining us live today to tell us more is Dr. Javid Sakura, Chief of Psychiatry at Hartford Hospital's Institute of Living. Doctor, first of all, thank you for your time today because as a couple of gentlemen here chatting, you and I, this is a very important topic, and hopefully our conversation can help anybody watching or anybody that wants to talk to a gentleman. What do you think are some of the indicators of somebody that could be facing these challenges?
Yeah, so thanks for having me. It's a very important topic. I would say that generally when you see someone who's struggling, you'll notice because something might be off, they might be disconnected or detached, or they might have it show up in things like irritability or anger, or either being too silent or too quick to react. All in all, usually when someone's struggling, it's when they're noticing that they're not functioning as usual and their mental health is getting in the way of their day-to-day.
Now, doctor, would you recommend to sort of, in air quotes, break the ice or open up for a conversation where you may be worried about how to take the approach?
So it's pretty straightforward. I think we want to try to say what we see if you're noticing something, but you also want to show that you care. And how that requires us to not try to fix someone, but just to let them know that we're here if they want to talk or if there's anything that they want to share with us, knowing that we won't judge them and normalizing the feeling of any messy or complex emotions.
Now, of course, you're representing Hartford Healthcare. What are some of the steps somebody can take professionally to maybe get help with this situation?
So I think it's important to start with just asking for help. As men, we often have these stereotypes that we should tough it out or make it through things on our own. So asking for help to anybody requires a lot of courage and is the strongest thing we can do. From there, access to that whole continuum of care, whether it's through primary care, whether it's something more serious, someone might need therapy or something even more. We at Hartford Healthcare, at the Institute of Living and our Behavioral Health Network are here 24/7. And of course, if someone's struggling or in crisis, to definitely seek emergency supports or contact 988.
Now, are there any ways you could describe to our viewers, are there any examples where you've had a conversation with someone and then worked with them and then where they ended up over time?
Yeah, I think it takes a lot of courage to ask for help. But at the end of the day, we all have to be able to have compassion for ourselves and others. Oftentimes when people are reaching out and they're going through some of their struggles, it's just by being able to sit, normalize, validate, co-create, and help people reconnect to themselves. I think that's the most important thing. We all have what it needs. We all know that we really are good enough, that we have worth. And the work that I get to do through Hartford Healthcare helps to reconnect many of the men that I work with that idea that they already have it built inside of them. We have to get out of the way and help them know their strengths and honor themselves.
Well, Dr. Javid Sakura, we thank you for your work on this very important topic. I'm sure it's not easy for you as well, so we really appreciate you being here today.
Thank you so much, and I hope everyone takes care.